Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Cat scratch disease. Introduction. Cat scratch disease is an illness caused by bacteria found in cat saliva. The bacterium that causes cat scratch disease is called Bartonella henselae. Almost half of all cats carry the bacteria that cause cat scratch disease at some point. The infection does not make cats sick. However, a scratch or bite from an infected cat can cause symptoms in people. This program explains what cat scratch disease is and what causes it. It also covers diagnosis and treatment of cat scratch disease. Bacterial infections. Cat scratch disease is caused by the bacterium Bartonella henselae. Bacteria are living things that have only one cell. Under a microscope, they look like balls, rods, or spirals. They are so small that a line of 1,000 could fit across a pencil eraser. Most bacteria won't hurt you. Less than 1% makes people sick. Many are helpful. Some bacteria help to digest food, destroy disease-causing cells, and give the body needed vitamins. Bacteria are also used in making healthy foods like yogurt and cheese. But some bacteria can harm you. Infectious bacteria can make you ill. They reproduce quickly in your body. Many give off chemicals called toxins, which can damage tissue and make you sick. Bartonella henselae, the bacterium that causes cat scratch disease, belongs to this category of harmful bacteria. Antibiotics are often used to treat bacterial infections. When you take antibiotics, follow the directions carefully. Each time you take antibiotics, you increase the chances that bacteria in your body will learn to resist them. Later, you could get or spread an infection that those antibiotics cannot cure. Symptoms and complications. The first symptom of cat scratch disease is a blister or small bump. This sore develops where a cat has bitten or scratched you. This happens several days after being scratched or bitten by an infected cat. It may look like a bug bite. A couple weeks after getting scratched or bitten, lymph nodes may begin to swell and become tender or painful. Lymph nodes around the head, neck, and upper limbs are usually affected. Swollen lymph nodes are the main symptom of cat scratch disease. Often, the illness is mild. Other symptoms may include fever, headache, poor appetite, rash, sore throat, tiredness. Sometimes cat scratch disease can cause other infections in the bones, joints, liver, spleen, or lungs. It may also cause a high fever without any other symptoms. However, these cases are not common. Some people may get an eye infection when they have cat scratch disease. Symptoms include eye redness, small sore on the lining of the eye, swollen lymph nodes in the ear. Very rarely, cat scratch disease can cause inflammation of the brain and seizures. However, complications caused by cat scratch disease rarely cause long-term damage. People with cat scratch disease usually do not remember being scratched or bitten by a cat. If you have been around a cat and have symptoms that do not get better, contact your healthcare provider.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Cat scratch disease is caused by a bacterium called B. henselae. It is short for Bartonella henselae. The B. henselae bacteria do not cause a cat to become sick. However, an infected cat can pass the bacteria to humans. People infected with the bacteria will develop the symptoms of cat scratch disease. The bacteria spread through a cat's saliva. This means that a cat bite can infect a person. Sometimes the bacteria can also spread through being scratched by a cat. This is because the bacteria can get on the cat's paw when it licks itself. You can also become infected if a cat licks your skin near an open wound or cut. However, this is less common. If an infected cat has just bathed itself, petting the cat can transfer bacteria to your hands. Rubbing your eyes can then cause the bacteria to enter your body. This is also less common than a scratch or bite. It is estimated that almost half of all cats carry the B. henselae bacteria at some point in their lives. Kittens are more likely to be infected and to pass the bacterium to humans. Cat scratch disease cannot be spread from person to person. Sometimes multiple family members can get cat scratch disease. However, this is often because they are around the same infected cat. When to see a doctor. Often cat scratch disease is mild. It can be difficult to know when to contact your healthcare provider. This section explains when you should seek medical advice. Contact your healthcare provider if a cat bite or scratch becomes infected. Signs of an infection include a scratch or bite that doesn't heal, redness around the cat scratch or bite, fever that lasts several days, painful or swollen lymph nodes for more than 2 or 3 weeks. Also contact your healthcare provider if you have bone or joint pain, abdominal pain without vomiting or diarrhea, tiredness for more than 2 or 3 weeks. People with weakened immune systems often have more serious symptoms. This may include people who are undergoing certain cancer treatments, have had an organ transplant, have HIV or AIDS. Contact your healthcare provider if you have the symptoms of cat scratch disease and have a weakened immune system. Often your healthcare provider can diagnose cat scratch disease based on your symptoms. If you were recently bitten or scratched by a cat and have swollen lymph nodes, you likely have cat scratch disease. If the diagnosis is not clear, a blood test may be done. A blood test can confirm if the bacterium that causes cat scratch disease is present. Blood tests can also rule out other causes of swollen lymph nodes. Treatment. Treatment is not usually needed for cat scratch disease. Most cases of cat scratch disease are mild and go away on their own. Taking over-the-counter pain medication can help with the symptoms. Some examples include aspirin, ibuprofen, naproxen. Applying heat compresses can also help with painful, swollen lymph nodes. Antibiotics may be needed if lymph nodes remain swollen for 2 months or longer. They can also help if you have a fever for a long time or if the infection is in the bones, joints, liver, spleen, or lungs. Sometimes a large, painful lymph node may be drained to provide relief. This is done by inserting a needle into the lymph node and removing the fluid inside. Prevention. The only way to prevent cat scratch disease is by avoiding cats completely. However, there are some steps you can take to reduce your risk of cat scratch disease without avoiding cats. 1. Avoid stray or unfamiliar cats. This can reduce exposure to sources of bacteria. 2. Avoid rough play with cats, especially kittens. This includes any activity that may lead to cat scratches and bites. 3. Do not tease your cat or kitten. Teasing or irritating a cat can cause the cat to bite or scratch. 4. Wash cat bites and scratches immediately and thoroughly with running water and soap. 5. Do not allow cats to lick open wounds that you may have. 6. Wash your hands if they are licked by a cat. 7. Control fleas. Fleas can spread the bacterium that causes cat scratch disease between cats. Fleas cannot spread the disease to humans. Talk to your healthcare provider if you have any concerns about cat scratch disease.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cat scratch disease is an illness caused by the bacterium Bartonella henselae. Almost half of all cats carry the bacteria that cause cat scratch disease at some point. The infection does not make cats sick. However, a scratch or bite from an infected cat can cause symptoms in people. Swollen lymph nodes are the main symptom of cat scratch disease. A small bump or blister often appears before the lymph nodes swell. Sometimes cat scratch disease may cause more serious symptoms, but this is not common. The bacterium that causes cat scratch disease is spread through a cat's saliva. This can happen through a bite, scratch, or lick. Rarely, bacteria may also enter the body through rubbing the eyes after petting a cat. Most cases of cat scratch disease are mild and go away on their own. If treatment is needed, it may include antibiotics or draining large, painful lymph nodes. Luckily, often the illness is mild and does not cause long-term complications.
Thank you for using Explain.